Good morning. Today we are going to discuss about the oral cancer. This topic we are going to discuss in two parts, like part 1 and part 2, as it is a little extended topic. Okay, let's revise. We will have multiple choice questions on each many topics, like we will discuss. First question is, brachytherapy refers to what? What does it mean? It is intensity modified radiation therapy, or is it like isotopic implants are as radiation sources are placed in the tissue to be irradiated, or it refers to image guided radiation therapy or concurrent chemotherapy and radiation therapy. So what is the word brachytherapy means? It refers to the placement of isotopic implants in the tissue to be irradiated as radiation sources. Only that particular tissue will be irradiated with these implants. Next question. Treatment modality preferred for the advanced cases of oral cancer is, that is in T3 T4 when the lesion is large. So what is the treatment modality preferred? Is it surgery followed by the radiation therapy, or radiotherapy followed by surgery, or radiotherapy and chemotherapy, or surgery and chemotherapy? So which modality? That is radiation therapy and chemotherapy are preferred in case of advanced case of cancer. Next, dysplasia refers to what? It means hyperchromatism or increased mitotic activity in the tissues, or alteration of the normal cellular activity and its orientation and maturation, or all the above are true. So dysplasia means what? Which change? So all these changes will refer to dysplasia. That is, it is an histopathological describing word. Okay. So these changes, if we are seeing in the microscope in the tissue, we will refer to as the dysplastic changes have started. Next question is, fixation of lymph nodes to the adjacent tissues indicates what? Progression of the tumor is aggressive, or lymph nodes are not involved, oral squamous cell carcinoma is confined to the oral mucosa, or all the above. So the correct answer is progression of the tumor is aggressive. In such cases, the nodes are not movable when palpated. They are fixed to the surrounding or underlying tissues. So that shows that the carcinoma is progressing very fast. Next, smokeless tobacco refers to use of what? Pan chewing, quit, snuffing, or all the above. Correct answer is all these are the different forms of smokeless tobacco usage, especially seen in the Asian countries. Pan chewing, quid and snuffing. Next, oral squamous cell carcinoma is more prevalent in young females, or commonest cancer in the males, or dorsum of the tongue is commonly involved, or all are true about the oral squamous cell carcinoma. It is more prevalent in the males. Commonest cancer in the males is oral squamous cell carcinoma is true. Next, common site of occurrence of oral squamous cell carcinoma is floor of the mouth, tongue, tonsillar pillars, or all the above. Correct answer is all these sites are the most common sites of occurrence for oral squamous cell carcinoma. As we discussed, in Asian countries, oral squamous cell carcinoma involves buccal mucosa. Why? Is it because of the smoking habit, or tobacco chewing habits, or genetic factors, or all that? So what is the reason? The reason is tobacco chewing habit. That is, they use mostly smokeless tobacco, in which like it may be pan chewing, quid, or snuffing. So like mainly with pan chewing, but they will place this pan in the sulcus or vestibular sulcus, so that the buccal mucosa is most commonly in contact with the tobacco product. Because of that, the oral carcinoma is more common in the buccal mucosa in case of Asian countries because of smokeless tobacco usage. Signs of lymphatic spread of the oral carcinoma includes, what are the different signs? Unilateral, bilateral lymph node enlargement, firm to hard on palpation. These nodes are firm to hard and they are non-tender. So what are all the above? So what are the different signs that will indicate that the oral carcinoma has spread to the lymph nodes? So all these are the signs. All the above are correct. Next, carcinoma in situ refers to stage 1 carcinoma, or carcinoma involving only the oral mucosa, or carcinoma involving only epithelium, or a very small lesion with dysplastic changes? Correct answer is that involves only epithelium. This is an histological term in which we will see the dysplastic changes only in the epithelium part, not spreading to the connective tissue. They will not cross the basement membrane only. So that is refers to as carcinoma in situ. Next, choice of treatment for oral cancer depends on what? Size and site of the lesion, cell type involved and the degree of differentiation of the tissues, lymph node status, and all the above. The correct answer is all these factors will be affecting the treatment planning. So which mode of treatment we have to select. Next, treatment planning in radiotherapy depends on size and site of the tumor. Particularly in radiotherapy, again we are discussing, not in general. In radiotherapy also depends on what treatment planning, like how many doses or how much radiation to be given in each session, like that will depend on what? Size and site of the tumor, volume of the tissue to be irradiated, or tolerance of the patient, or all this will affect the planning. The correct answer is all these factors will be considered during treatment planning with radiotherapy. Tumor that is less response to the radiotherapy is poorly differentiated tumor, or highly invasive tumor with less growth on the mucosa, or exophytic lesions which are less responsive, means others are more responsive. So are all this or all of these are less responsive. The answer is highly invasive tumor with less growth on the mucosa is less responsive to the radiotherapy. Exophytic lesions and poorly differentiated tumors are more responsive. What are the different primary modes of treatment for oral cancer? As we are discussing already, what are the different primary modes of treatment? Surgery, radiotherapy, chemotherapy, or both surgery and radiotherapy? The answer is both surgery and radiotherapy are the primary modes of treatment. Even chemotherapy is done, but primarily we are considering surgery and radiotherapy as the standard modes of treatment for oral cancer. Fine needle aspiration is a method of choice for enlarged lymph nodes, oral squamous cell lesions, or lip carcinoma, or all the above, in which case FNAC is preferred, that is fine needle aspiration is preferred. In case of enlarged lymph nodes, this particular fine needle aspiration is preferred to check the histopathological changes before going with the biopsy. Next, most common signs of oral squamous carcinoma include signs, not symptoms. It is red, white, or red and white lesion. Clinically, we will see red lesion, white lesion, or red and white lesion. Or there is a change in the surface texture of the mucosa in any particular area. Or we will see some growth, mass, or ulceration of the mucosa, or all the above. So, which one is most common sign of oral carcinoma clinically? So, all these are commonly presented clinically. Next, addicting drug present in the tobacco is, what is the main reason for the tobacco addiction? It is nitrosamines or hydrogen cyanide or nicotine or polonium. It is nicotine is the main reason for the addiction of the tobacco. Most common type of oral cancer is it malignant melanoma, osteosarcoma, squamous cell carcinoma, or multiple myeloma in the head and neck, like in the oral cavity? What is the most common type of cancer? It is squamous cell carcinoma is the most common type. What are the different types of cancers prevalent in head and neck region? Is it malignant melanoma, squamous cell carcinoma, basal cell carcinoma, or all the above? Which are the different type of cancers that are more prevalent in the head and neck region? It is all these are most commonly prevalent in the head and neck region. Next, tobacco smoke contains what? Is it like thiocyanate and hydrogen cyanide, cobalt, nicotine, or all the above? So smoke mainly. The most addicting drug is nicotine we discussed, and the smoke contains what? So all these chemicals are present in the smoke coming from the tobacco. Most common symptom of oral squamous cell carcinoma. Again we are discussing about the symptoms. dysphagia, oral bleeding, discomfort, or some mass in the mouth. What the patient will complain to you most commonly. It is the most common early complaint will be the discomfort in the mouth. So with reference to the computer assisted oral brush biopsy, which is true, sensitivity is 100%, no false negatives are reported, it is a non-invasive procedure, all are correct. So all these statements regarding the oral brush biopsy are correct. That is, the sensitivity is 100% and false negatives are absent, and it is a non-invasive procedure. Following statement is not true regarding verrucous carcinoma. Verrucous carcinoma, clinically it is a cauliflower-like lesion, which is not true, we are asking. There is severe dysplasia seen histologically. Locally it is a destructive lesion, only locally destructive lesion, and it is resistant to radiotherapy. So which statement is not true? So severe dysplasia seen histologically is not true because it is locally destructive lesion, and clinically cauliflower-like appearance is seen, and it is resistant to radiotherapy. So only severe dysplasia is seen histologically is wrong. Dysplasia is mild, though the clinical growth is more. Surgery is the treatment of choice in case of oral carcinoma of the tongue in young individuals, or clinically palpable cervical lymph nodes, or in all these cases when the surgery is preferred. So when there is clinically palpable lymph nodes are involved, means there is lymphatic spread, means only surgery is the treatment of choice because it includes even the removal of the involved lymph nodes. Next, failure of surgery. What is the reason for the failure of any surgical procedure? It is due to unrecognized neural, perineural or the lymphatic spread which was not diagnosed before surgery. So incomplete removal or seeding of the tumor tissues in the wound during surgical procedure. So what are the different reasons for the failure of surgery? Or all are correct? The answer is all these are correct. Next, verrucous carcinoma, which is true. It is a clinical variant of oral squamous cell carcinoma. It progresses from proliferative verrucous leukoplakia, and we'll see piling up of keratin is seen on the surface. Or all are true. So all these statements are correct regarding the verrucous carcinoma. With reference to Toledo blue staining, what is true? Which is true? False negatives are uncommon and false positives may occur, and it helps in the selection of the biopsy site. All are true. Answer is all these statements are true regarding the Toledo blue staining. Major genes involved in head and neck carcinomas include, what are the genes involved? Proto-oncogenes, tumor suppressor genes, histone deacetylation, or both only A and B, proto-oncogenes and tumor suppressor genes. It indicates both proto-oncogenes and tumor suppressor genes are commonly involved in causation of head and neck cancer. Carcinogens present in tobacco are, so what are the carcinogens present? Polonium, nitrosoprolin, nitrosodictanolamine, or all the above. So just remember all these chemicals are carcinogens present in the tobacco. Oral squamous cell carcinoma occurs in old age. Why? Duration of exposure to the risk factors is more. Immunosuppression is common in the old age because of the accumulation of the genetic changes, or all the above true. These are all the reasons for the most common occurrence of carcinoma in the old age. Next is risk factor associated with oral cancers or risk factors. Is it tobacco usage, candida infection, vitamin A deficiency, that is any nutritional deficiencies, or all the above? So all these are the risk factors associated with cancer. Next, diagnostic aids to oral examination. In diagnosing a case of oral squamous cell carcinoma include what the different diagnostic methods you will choose. It is imaging and light techniques like busy light, surgical biopsy or brush biopsy, vital tissue staining, or all these are used. Answer is all these methods are used to diagnose a case of oral carcinoma. Next, verrucous carcinoma clinically it may be papillary, cauliflower-like, verrucoid, or all are true. The answer is all are true. So it may be clinically mostly cauliflower-like, but in the initial stages it may be just papillary or verrucoid also. Surgery is indicated in oral cancer in case of tumor involving the bone, lesion is recurrent and that was previously treated with the radiation therapy, tumor that lacks sensitivity to radiation, or all the above. The answer is in all these cases surgery is preferred. Thank you. Thanks for watching, and just go through these topics and even go through the other options also, why not and why. Okay, so this keeps you in revising the topic completely. Thank you. Just keep tuned. Keep revising. Okay, thank you.